Life is about shedding the darkness and embracing the light of knowledge. So let's get together and awaken our minds. Friends, welcome to the series of videos of Awakening the Mind. My name is Dr. Akash Ahuja. I'm a psychiatrist here in Los Angeles, California. I did my medical school from Maulana Azad Medical College, New Delhi in India. And I did my residency in psychiatry from Hennepin Regents program in Minneapolis in the state of Minnesota in United States. Today we'll be talking about a topic which has been there in the history for thousands of years. We have all heard about it, but we know little about it. It's one of the most devastating illnesses ever, and I'm talking about schizophrenia. Many of you guys might have heard the name schizophrenia, the term schizophrenia, and many might not. But everybody has heard the name that he's crazy, he's stupid, he's crazy, and we have all seen that in some form or the other in either Bollywood or in Hollywood. Which, by the way, they are doing a better job now of depicting what the illness is. But I was thinking while growing up, I never heard about schizophrenia. I never see anybody talking about schizophrenia. And now that I treat so many people with schizophrenia, I have realized why. One of the biggest reasons that we did not talk about schizophrenia in the community is that we don't see them. And the reason we don't see them is that most of them have been locked up. Many of them have been locked up in their houses, in their homes, in their small towns or big towns, and many of them actually are locked up in the state institutions, the big hospitals. The care has become better for sure, but it's still nowhere near as where it should be in terms of this disease. So what is schizophrenia? Schizophrenia, in simple words, is a disease where a person loses the control of reality. He has no clue of what is real and what is fake. He starts hearing voices, he develops some fixed beliefs and so many things which makes him sometimes agitated, violent, and if not treated well, it can be very devastating. So let's talk a little bit about the details. I've made a slideshow which you guys can review after the presentation. So schizophrenia, people used to think, and people still think, my take is in some small towns, that people are possessed by demons, people are possessed by bad spirits, and it's not a psychiatric illness, but because they did something bad or their family did something bad, that's why God is punishing them with this particular situation or scenario. They are feared, they are tortured, they are exiled, locked up, and again these people have lost the touch with reality, but people have no clue that this is schizophrenia, and it's very, very treatable. The sad thing is that whenever I've talked to people in India and in other countries including United States, people are somehow okay with having diseases like diabetes and hypertension, which are equally dangerous, but nobody wants anything to do with schizophrenia. It's such a high taboo disease. Some people, as I mentioned, never see a psychiatrist as they face extreme stigmatization, and I've met with many folks in India and in here in California where the children who have schizophrenia, I mean the young people who have schizophrenia, are actually married to other people just because the family believes that everything will be okay once they are married. I mean, marriage is a good thing, but it has its own stresses, and people have no clue that they can basically exacerbate the symptoms of schizophrenia if they give people more stress. And how does it make sense of not letting the spouses know that these people suffer from this illness? So friends, let's talk about some of the symptoms which these people face. I've talked to them a little bit, but let's talk in details. Number one will be delusions. Now what are delusions? Delusions are such strong, fake, false beliefs that these people have, and it's very hard to get rid of. Medications do help, but otherwise it's extremely difficult. These beliefs, these illusions can be bizarre or non-bizarre. So what are bizarre delusions? Bizarre delusions are something which is technically not possible. For example, they might believe that the people from Mars or Jupiter have come down to Earth and have implemented or have put security surveillance chips in their brain, and they can monitor their activities. And they can also have some non-bizarre delusions, like they might believe that their wife or their children or their parents might be putting poison in their food and they're trying to kill them. Again, of course, not likely, but at least technically possible. That's why they are known as non-bizarre delusions. Other symptom they suffer from is hallucination. Now, what is hallucination? Hallucination is a sensation which these people hear or see which is not real. For example, it can be auditory hallucination, in which these people start hearing things, and they can hear things such as that they are bad people and that they should kill themselves, or they can start hearing things that that person sitting at the corner of that room is a bad person and God wants you to kill that person. So they actually might kill that person thinking that they are threat to that other person is a threat to the community. So in a way they are doing a social service, not knowing that their paranoia is due to this illness, this devastating illness known as schizophrenia. They can also have visual hallucinations and olfactory hallucinations. What that means is they might be seeing things which are not real. Again, common in people in Asian subcontinent with schizophrenia. And they might smell things which are not there or not real. They can have a very disorganized thinking, and they can become very agitated. Again, they don't become agitated because their nature is to hit people. They usually hit people or they show violence because they feel threatened, they feel scared, and they feel scared of somebody due to one reason or the other. They have poverty of speech as the disease progresses. What that means is that they will speak less words, they will use short sentences, and sometimes they even make up their own language, make up their own words as the disease progresses if it's not getting treated. They can show poor eye contact and cannot think through the process. They will not look directly at you but look like this while talking to you. And they can, as I said, they cannot think through. So even if they have to do like small things like going out, buying a ticket of a bus and going to some place, they might not be able to do that because their mind doesn't work that way. Friends, now let's talk about what causes this devastating illness which has affected so many thousands and thousands of people. So some of the reasons are hereditary. So if a parent has it, then it increases the chance of a child to get it. It can be genetic. There are certain genes which have been found which increases the chances of somebody developing schizophrenia. There is a chemical imbalance in the brain. Our brain has many chemicals, actually thousands of them, and two of them get really affected in schizophrenia. The names are dopamine and glutamate. Actually, in our brain pathways, dopamine actually becomes more, it increases in certain pathways, and that can really cause the sensitivity to sounds and things, and that can increase the chances of people developing schizophrenia. The brain structure of these people can also be a little different, as the research has shown. There are some open spaces in our brain known as ventricles, and these people, that ventricle space is a little bit bigger, and we have gray matter and white matter in our brain, and for these people the gray matter can be little less. Now, why am I telling these things and why are these things important? These things are just important to say that, like for example, we know the reasons why somebody gets diabetes and high blood pressure. It's important to know that these illness, schizophrenia, is also caused by these organic and genetic and hereditary reasons, and is not due to bad spirits or demons or because somebody has done bad things in their life, and that's the reason that they are suffering from schizophrenia. accepting schizophrenia is as a mental illness is the first step, and then the second step is to get it treated. It's very important, guys, that we just not show our love and affection to the people who have this illness, but actually get rid of the taboo and take them to a psychiatrist. That's the first step. The good thing about schizophrenia, or maybe the only good thing about schizophrenia, is that at least there are so many medications out there which are not that expensive, which can really treat schizophrenia. For example, the name of the drugs would be olanzapine, clozapine, Haldol, quetiapine, aripiprazole, and these medications actually lower the level of dopamine in that particular pathway we talked about and can control the symptoms. I've treated so many people of schizophrenia, maybe thousands actually, and many of those people actually lead a normal or close to a normal life. When their symptoms are stable, they can get a job, they can get married, start a family, live on their own, and live a reasonable life as compared to people who have not been treated or not been diagnosed with schizophrenia yet. There is also therapy which is possible for schizophrenia, but for that people need to be first stable on the medications. Family support again is extremely important, of not only showing love and care, but accepting the people with schizophrenia and making sure that they see a psychiatrist and get adequate treatment. Friends, schizophrenia is a devastating illness. I guess there is no doubt about it. But there are many associations, organizations, NGOs who have been working on that, and I guess me and you both share the burden of at least addressing this devastating illness, talking about them, spreading the education about them, and getting these people treated so that they can live at least close to a normal life. I guess we owe it to them. Thank you for watching this video.